Welcome to the Adoption and Foster Care Journey, a podcast to encourage, educate, and equip you to care for children and youth through adoption, foster, and kinship care. Hosted by an adoptive mom with over 22 years of kinship and adoptive parenting experience. She's on this journey with you. Please welcome Sandra Flack.
He gives strength to the weary and increases the power of the weak. Even youths grow tired and weary, and young men stumble and fall. But those who hope in the Lord will renew their strength. They will soar on wings like eagles. They will run and not grow weary. They will walk and not be faint. That is Isaiah 40, verses 29 through 31. I'm your host, Sandra Flack. Welcome to the Adoption and Foster Care Journey. I could certainly use some of that strength and power mentioned in Isaiah 40 as we wrap up 2024. How about you? I know my strength comes from the Lord, yet I confess I do fuel up on coffee every morning. I like really good, fresh roasted coffee beans, and I grind them and French press myself to the day, I guess you would say. What about energy drinks? I've never had one. What about you? What about our kids? I know I've got some kids who drink energy drinks, some adult kids who no longer live home, but today we are going to talk about the impacts of energy drinks and the impact they have on us, but we're really going to zero in on our kids who have trauma histories and prenatal exposure and, possibly autism disorder and all of those things that change our kids' brains. And then we introduce energy drinks and it'll be very interesting. So today we are going to learn all about it with our resident doctor, one of our most popular guests. Dr. Jerrod Brown is with us. Dr. Brown is a professor, trainer, researcher, and consultant with multiple years of experience teaching collegiate courses. He has also provided consultation services to a number of caregivers, professionals, and organizations pertaining to autism spectrum disorder, fetal alcohol spectrum disorder, confabulation, suggestibility, trauma, other life adversities, traumatic brain injuries, and youth fire setting. Jerrod has completed 4 separate master's degree programs and holds graduate certificates in neuropsychology, autism spectrum disorder, other health disabilities, and traumatic brain injuries. He completed a postdoctoral certificate in leadership and organizational strategy and a professional certificate in forensic psychology. Jerrod has published several articles and book chapters and is regularly featured on several international podcasts, including this one. Please welcome back Dr. Jerrod Brown. Hey, Jerrod.
Sandra, thank you for having me back, my friend.
It is always an honor, as you know. You are one of our most cherished guests, and your episodes are always some of our highest listened to or most downloaded, or however we would say it. So it's always an honor. And here you are. This is our last episode of 2024, if we can believe that already. Kind of crazy, but you have an impressive bio. I already read that. One of my favorite things about you also is that you and your wife are foster parents. So you get this journey. You're on this journey like the rest of us who are listening. So I really appreciate that as well. And over the past few years, we've talked about so many important topics that really impact children and families in the adoption and foster care world. And today we're going to discuss energy drinks. We've talked about the negative impacts of sugary beverages. It's the end of the year. We probably have all had our fill with that. But energy drinks, tell us about, how are energy drinks different than sugary beverages? We had done an episode specifically on that, but tell us a little bit about the difference and the impacts, why energy drinks are harmful, or how harmful are they?
Yeah, no, thank you. Thanks again, Sandra, for having me back and those kind comments. Always honored to be here. And I have even a greater appreciation for foster care parents. I had a big appreciation before, but now actually doing it even more. So definitely thank you. Well, I think in the past we've covered a lot of stuff related to nutrition. I think I mentioned I am working on another degree in applied clinical nutrition. And as I'm getting deeper in the weeds with this, I'm even more convinced that when you are raising a child, any child, but especially a child that has like FASD or autism or ADHD or extensive trauma or attachment problems, it is so important to consider what that child is consuming in terms of food. And I've consulted on enough cases now over the years, not through a nutrition lens, but more from a behavioral and forensic lens, where energy drinks comes up in the discussion frequently. And I've been studying now energy drinks probably for the last few years, and just I'm scared. All the things I've learned about over the last few years, and people are shocked to learn that there's studies out there on excessive energy drink consumption within the context of suicidal behavior, depression, anxiety, bullying, teasing, and even violent behavior. I'm not saying if you drink energy drinks, you're going to go commit a crime. But let's say someone has a vulnerable brain and they're dealing with lots of trauma, and now you have someone consuming tons of energy drinks. That just makes the brain not work properly even more. So energy drink consumption, let's just think about a little bit. If you look at the ingredients on energy drinks, and they're really good at marketing, and I'm not going to point out any energy drink company, but excessive energy drink consumption is a threat to human health. Why? Look at the ingredients in there. Now, some of the ingredients are going to be probably healthy, but look at the added sugar. Look at the amount of caffeine someone is consuming in a short amount of time. Caffeine on a low level, and I'm not giving any nutritional advice, caffeine on a low level may be pretty good for you, but at the moderate to severe level, it's not good at all. It's been linked with all kinds of different things. And I would really classify excessive energy drink consumption really is an aspect of a poor quality diet. Now, we all know that processed foods, sugar sweetened beverages, foods loaded with different kinds of trans and saturated fats and added sodium and lots of sugar, and people that don't hardly ever eat vegetables or fruits or even whole grains. Those are all things associated with a poor quality diet. The research is pretty clear in that somebody that consumes a ton of energy drinks, and again, it's going to differ from person to person. Oftentimes, it's not just the energy drinks we're talking about. A lot of times, they may be skipping a lot of meals. They may be eating a lot of fast food. They may be more likely to smoke cigarettes or drink alcohol in conjunction with the energy drinks. So it's not just the energy drinks that we need to take into account, but what other kinds of highly processed foods are they having, which are basically foods that fall under the umbrella of the Western diet. So when we think of energy drinks, basically these are drinks that are loaded with caffeine, added sugars, sometimes a number of other additives, and legal stimulants. And a lot of times these drinks are marketed as like athletic enhancing, mental stimulation enhancement. And a lot of times they're marketed to younger individuals, the research says. So on the surface, it can look like, hey, this is pretty good for me because it's got all these different kinds of ingredients that look good. But what about the added sugar and the caffeine and sometimes other processed ingredients? So you got to really learn to read those labels. And it's very clear too from this research, and there's a whole long list of things to be aware of, but some of the potential adverse health effects that have been mentioned that may be associated with excessive energy drink consumption is increase in headaches. That's talked about a lot. over time, if someone's drinking these drinks day in and day out, and maybe someone's working the night shift and they're drinking these drinks because they're just exhausted and they're trying to stay up all night, that can have an adverse impact on our cardiovascular health. So it can actually impact our heart health over time. I'm not talking about someone that has an energy drink here and there. You might have more muscle twitching. You might have more restlessness. Clearly, it impacts sleep. If you have a lot of caffeine, especially later in the evening or even after lunchtime, caffeine can have a half-life of many, many hours, which means if you have caffeine at 12 noon, several hours later, that caffeine's probably still in your system. And if we're talking about a child or a teenager who has like FASD, for example, I have no idea what that does to the brain because there's no empirical based literature out there on these kind of drinks, the FASD brain. But I've seen it anecdotally and I've heard enough stories from caregivers. It does not help the situation get better. It makes it a lot worse. And we can talk about why that's the case, but those are a few of the negative impacts. I mean, I can go a lot deeper in the weeds, Sandra, if that's helpful, but I will stop talking and kick it back to you when any thoughts you have.
Yeah, no, I hear everything that you're saying, and it, of course, it makes sense, and it appears that, you know, especially excessive use of this, if an individual is dependent on that, say they are working the night shift, or, you know, whatever's going on in their life, and they you know, studying, you know, high school or college age kids who are up late studying, and they're drinking these drinks to stay awake and to be able to do that, or whatever the reason might be. It sounds like if they're doing it a lot, then that's, you know, more harmful, but especially harmful to children. And then you did mention kids with FASD. So, you know, a lot of our listeners have kids who have been prenatally exposed. They have trauma, maybe autism, some other brain difference. So why would energy drinks not be a good idea for our kids who are on one of these spectrums or who've experienced trauma?
Well, just thinking about obviously the brain, and obviously if a brain was exposed to drugs or alcohol in utero, they already have an underlying vulnerability. Again, we know that alcohol doesn't only impact the brain, it impacts the body.
Mm-hmm.
And a lot of times too, we're not just talking about alcohol in utero. If you look at some of the research, cigarette smoking is more common when a woman is drinking alcohol during pregnancy. Are we also talking about marijuana exposure, other harder kinds of drugs? And then after that child is born, what is the environment they're in early on in life? And in some cases, that child may be raised early on in life in a home that might be characterized by chaos, dysfunction, abuse, all kinds of trauma. And now we have not only the prenatal trauma, but after birth kinds of trauma disruptions that can impact attachment, that can impact the brain even more. And it's just pouring fuel on the fire. We need a multidisciplinary approach to work with these children effectively. And in an ideal world, and I'd love to hear from folks if you disagree with this, if you are raising a child, let's just pretend a child with FASD who has a lot of other kinds of trauma on top of that, so high levels of adverse childhood experiences and attachment problems. A lot of times, caregivers, foster care parents, you're going to be working with therapists, you're going to be working with case managers, pediatricians, maybe a psychiatrist as that child gets older. Wonderful. Very, very, very important. What's missing from that equation that I see a lot when I talk to caregivers? A dietitian, a nutritionist, a sleep specialist, an exercise specialist, bringing in the holistic element into this as well. Very important to have speech language communication, occupational therapy, case managers, skills workers, therapists. So important. But are those folks also targeting the underlying metabolic issues, the inflammation, the gut, the hormones, the sleep, the circadian rhythm, the dietary practices? A lot of times the answer to that is no. We have to bring in that other element, and then it's more holistic, it's more well-rounded. Lots and lots of parents that I've consulted with over the years, do a heck of a job. They love their kids dearly, but they don't have the education or training on, do I allow my kid to have a big piece of birthday cake that's loaded with preservatives and sugars? Or do I go to fast food? Do we eat pizza all the time? That's all fun. It's wonderful. It's great on the surface. It's not good for the body, and it's hard. I get pushback from people and say, well, can't we ever have fun? Well, I'm not saying that, but really look at what that child is eating and consuming, and also look at what you're eating and consuming. Maybe you're a parent and you love your sugar sweetened beverages. Occasionally you like to have an energy drink. Not bad on the surface, but that child is observing you and absorbing that. And if it's a child with FASD, they're even more impressionable. They're even more likely to glob on to these things. You really want to be aware too. Caregiver modeling, not just with your words and actions, but with what you consume and what you eat and stuff too. That does play a role there. And I know it's a hard discussion to have, but it's an important one to have. And everything I'm saying too, if you don't believe what I'm saying, the research is very clear on this too. Maybe not specific to FASD, but children in general. There's so many studies on all these things with just child development in general.
Sandra Flack, host of the Adoption and Foster Care Journey podcast, and FASD educator Debbie Raymond, invite you to join Hope for the FASD Journey, a virtual support community for parents and caregivers raising individuals with fetal alcohol spectrum disorder, diagnosed or not. This faith-based support community meets online 3 times each month, features special VIP guests, and a private Facebook group for members only, which includes Soul Care Saturday video devotionals led by Sandra and Deb. Both Sandra and Deb are adoptive moms raising kids with FASD and facilitators of the Facets neurobehavioral model. For details and to register, visit justicefororphans.ny.org/hope-community. That's justicefororphans.ny.org/hope-community.
Yeah, and I think if you're not used to paying attention to nutrition, you might not realize how much what we eat really does affect everything. And I've been on a journey for the past 8 months where I've significantly reduced gluten and carbs and white flour and any kind of processed things and sugar and all of that. I don't have a food allergy, but just for my own health, I've increased my nutrition. So I'm more fruits, vegetables, and protein, lean protein, and significantly reduce those other things. And just recently we had pizza one night with our kids, and I love pizza, but I have not been eating it. And I noticed after having pizza, for not having it for a long time and for not having white flour or bread, I had a stomach ache afterwards. I found, I had itchy patches on my skin, and I just link it back to here. I introduced this food back into my body, and my body is telling me, not good. So I think that until you experience it yourself, sometimes you don't realize the effect, the food is having, what kinds of foods we're eating does have on our body. So it's definitely something to pay attention to for ourselves, but especially for our kids who have brain differences, because it is going to affect their diet, will directly affect, the behavior that we're seeing and how their body and brain works. And if, we're putting in, remember that old saying, garbage in, garbage out. We put that healthy stuff in, we're going to have better outcomes, across the board. So definitely so important to pay attention to that. Another question I had, Jerrod, was, are energy drinks addictive?
Sure. Yeah. Then maybe some people might not like the term addictive. I'm fine with that, but maybe it's habit forming.
There you go.
I mean, you got a lot of sugar in there.
Yeah.
You got caffeine. A lot of these drinks taste good. They're fun on the surface. They can become habit forming without a doubt. I have consulted with several group homes over the years on a variety of topics, and not knocking group homes at all. Great stuff they do. A lot of the group homes that I have consulted with, they serve the food that most Americans eat, highly processed foods. Sometimes they reward their clients with pizza night. Sometimes they reward their clients with a trip to the gas station. What does the client buy? A soda, a sugar sweetened beverage, a candy bar. When I educate these group homes about this, sometimes in one ear out the other, I can tell they don't want to hear, what are you talking about? This is fun. The clients love it. What you said can be applied to any setting. We're dealing with a topic that is highly sensitive, I see, and we're swimming up a stream because unfortunately in the United States, a lot of the food that's served in schools, hospitals, jails, prisons, group homes, treatment centers really would fall under the umbrella of the Western diet. Now, I'm not saying these places are actively serving energy drinks, but some of these places probably haven't had the education around the true harmful effects that energy drinks can have, including basically habit forming behavior. And if you look at some of the research, and this is specific to adolescents that I'm going to share right now, if you just Google energy drink consumption among adolescents and its impact on emotional and behavioral problems, you will find studies that have been published that have found that excessive energy drink consumption among adolescents may increase depression, stress problems, anxiety issues, more emotional problems, more self-destructive behaviors, an increased likelihood of risk-taking behaviors, and in some cases, violent behavior. There's other studies too that have found that it's really the overconsumption of energy drinks among adolescents may increase substance use issues as well, where that adolescent may be more likely to consume higher levels of alcohol, start smoking, use marijuana, and maybe be at an increased likelihood of using non-medical prescription kinds of drugs. It's really scary stuff. And there's some evidence too out there that the overconsumption of energy drinks, which may then contribute to higher risk behaviors, may contribute to some people engaging in more inappropriate sexual risk-taking and driving under the influence of alcohol. You'll find studies on this that talk about, especially if you're combining energy drinks and mixing alcohol with that, some people underestimate the impact that's having on their system. And now they think, oh, I'm fine, I feel good, I'm alert. And they drive behind the wheel. Very dangerous. And there are some studies too that if people are consuming these drinks and mixing it with alcohol, they may be way more likely to have intercourse with people they don't know, and all kinds of bad things you can imagine can happen there as well. So study after study looks at these things. There's so much out there on this. It's not just a few studies that talk about this. Numerous studies do.
Jerrod, it almost makes me think of it as energy drinks as a gateway to all of these other risky behaviors and negative outcomes.
I'm going to 100% agree with you. Now, by no means is it going to equal a gateway into other problematic behaviors in every case, but it should be, in my opinion, a very important targeted area for intervention. If you are working with young kids who are consuming lots and lots of energy drinks, lots and lots of sugar sweetened beverages, they're not good for human health at all. They're not good for brain development or body development. They may taste good. People may say, hey, you're being mean. Why would you try to take these wonderful things away from the child? If you learn the research, you will understand why that's the case. And targeted intervention may open up the door to other avenues. Maybe there's some impulse control problems here. Maybe there's lack of supervision going on in that household where parents need a little more education or support. Maybe there's some trauma going on, and that child or teenager is dealing with such internal distress. They're using these drinks to calm their system down, which probably will help them feel better in the short term. But what happens in a few minutes or 20 minutes, 30 minutes? Hormones are out of whack, their guts off. Now you may see an explosion in other kinds of behavior, irritability, moodiness, high anxiety. And if they couple that with sedentary behaviors, they're not exercising and they're on the screen all day long, and they're also snacking on fast food or other kinds of not so good foods, you got a recipe for lots and lots of body problems and even more brain-based issues.
Wow. Goodness. So there's so many things to take into consideration. So for those of us who are parents to adolescents or, kids who can sort of go to the store, somehow get, purchase their own things at the store, how can parents tell can parents tell if their child has been drinking energy drinks if we don't know, like if we don't see them buy it, if we don't buy it for them, yet maybe they're sneaking it? Is there a way we can tell?
That would be tricky if you have no clue whatsoever. But red flag indicators, if you could, maybe there's an increase in restlessness. You're seeing a lot of hyperactivity. You're seeing changes in sleep patterns.
Mhm.
You're starting to notice that child's putting on some pounds because some of these drinks having lots of sugar, they may have higher calorie intake. So looking at those subtle cues, maybe being aware of their friendship with other individuals. What's their network like? If you notice their friends are consuming a lot of these drinks, that may be a red flag indicator. If you're finding wrappers under their bed or in their closet, of course. If you are noticing trends, if you like monitor social media and you're seeing more pop-up ads for these kinds of drinks, you may see patterns there. What I will say is overconsumption of energy drinks, consequences again are many and varied, but more insomnia, obesity, mental health problems. They are associated with later bedtimes where that person may not be able to fall asleep as much. Other unhealthy dietary patterns do co-occur with this. They are linked with more sedentary behaviors, higher video game usage, and overall increases in screen time exposure, the research has said as well. So the more of those patterns you're seeing, I'm not saying it's always going to be energy drinks, but the light bulb should go on our minds. Maybe we need to dig a little bit deeper, have discussions here, ask some more probing questions. That would be helpful, I think.
Yes, and certainly be paying attention. I haven't had a problem with the energy drinks yet with my youngest son, who's 19. But I did go into his room this morning to wake him up for school. And in his little trash can, there were like 4 empty cans of iced tea. And I don't buy that. But what I realized right away, my husband is the one who's been picking him up from school. And so for a treat, my son wants to go to, a local convenience store on the way home. So my husband lets him go in and get something, and he comes out with one of these iced teas because he knows he's not supposed to go in and buy soda. I didn't know they were doing it until, several days go by, and then I find all these empty, and I'm like, oh yeah, now we have to correct this because it can easily, especially because of the FASD, I think, it becomes, now there's a new habit. Right now, every day dad picks me up, we go to the convenience store, I get an iced tea, right? So then it's like an everyday thing. And it's sort of like this routine has started before I even realized it started. Mom wouldn't have done it, right? Mom doesn't do that, but dad was doing it. So it's really paying attention and seeing what's going on like that, because now we have to, and in moderation, like, once in a while, not terrible, but when it becomes an everyday or weekly or whatever, you're forming unhealthy habits, which can just lead to more, more poor outcomes. So, Jerrod, what can, actually, how about this? Do you know of an alternative if, our kids or anyone who's sort of kind of gravitates towards those energy drinks, is there something healthier to reach for instead?
Obviously, in an ideal world, water is good, but
Yes.
that's not going to happen, of course. But work with a nutritionist again. Maybe once I become a licensed nutritionist down the road, I'll give some specific recipes and stuff. But any parent that's raising a child with special needs, I think would do well consulting with a licensed nutritionist or registered dietitian. There are lots of alternatives out there. Looking at your ingredients list, I'm assuming, Sandra, is it safe to say the teas your son was drinking were the sweetened kinds of teas?
Oh, of course.
Of course. Look at the sugar content, learn how to read the labels. And a lot of these drinks, too, if you look at it, we think that one can or one bottle equals a serving. Depending on the size of the can or bottle, there may be 2.5 servings in there. So now we have to double the
Yeah.
sugar content in there. So learning how to read labels, I think, is so important to battle this.
Yeah.
Having a harm reduction model, can't do all or nothing. That doesn't seem to work. But then be aware of what you have in your house. What kinds of drinks do you have? Maybe looking at the Mediterranean diet. I love the research on the Mediterranean diet. What drinks fall under the Mediterranean diet? Looking at other healthy options that taste good. Now, again, I'm not giving nutritional advice here, but organic coconut sugar, is that better than having high fructose corn syrup? I mean, looking at other alternative sweetener options, that's where a good nutritionist or registered dietitian could come in and maybe make some recommendations. Your child or teenager, they love something that tastes sweet. How do we make it taste sweet and get rid of all these preservatives and all these other additives that are not going to be good for their gut or their brain? That's
Yeah.
as much as I think I can say on that. I want to say more, but I better not. So
Yeah, no, that's wonderful. And I think engaging our kids in, together, learning, teaching them how to read the labels, talking about these things, and then, making that part of, meal preparation, things like that. I know to get our kids to drink more water, it's funny that when you said that, because my granddaughter, who's going to be 11, for Christmas, she wanted, how the Stanley Thermos Company is all like very popular now, and everybody wanted for Christmas these Stanley, the metal cups with the straw. And she wanted a purple Stanley cup for Christmas. So I got her a purple Stanley cup for Christmas. And, it was a big one that I had to get her because purple must be a very popular color. And it was hard to find, but I got it for her. But the day I gave her her Christmas gifts, she opened that up and she went right to the kitchen and she rinsed it out. She filled it with water. And while I was there, I think she had filled it twice because she was drinking water because now she was excited she had this cup. So making it fun, buy them a water bottle or a cup in their favorite color, and, make it a fun alternative. I think those are things that we can do just to teach nutrition and to help our kids, with things like this. So Jerrod, what can parents or caregivers do to help our kids eliminate the energy drinks from their diets?
what you said, that's a great idea. That also reminded me too that I think like an occupational or sensory processing specialist or even a feeding specialist might be another person to consult with as part of a big multidisciplinary team. What else can you do? Increase your knowledge. So if you hear this today and you find it interesting, read up on it, consult with other people, increase your knowledge and awareness. Look at some of the nudging interventions. If you Google nudging interventions around this, that's a really subtle way to make change. We're not coming in hot and heavy and all or nothing thinking. Nudging takes it really slow. Nudging it's like product placement. So like in your house, think of product placement. What do you have in your house that that child can turn to? Make it fun, make it visually appealing, but maybe what you're making fun and visually appealing is healthy for that child too. Getting some buy-in from the child, teaching them cooking skills, having a family night where you are cooking together and you're cooking things that look and smell visually appealing, but again are very healthy. If that child, teenager is dealing with other kinds of factors that could indicate an unhealthy lifestyle. So, for example, excessive screen time exposure,
Mhm.
sedentary behaviors, chronic loneliness, self-esteem issues, even alexithymia. There's some research on this, is really interesting, that a high level of alexithymia has been found to be more common among kids with FASD and other kinds of neurodevelopmental disorders. There's a couple articles out there too that have found high levels of alexithymia may contribute to more caffeine usage. Alexithymia is emotional blindness, where that child or adult has a hard time naming, processing, and labeling their emotions. So why I'm saying that is, if you know that there's an issue in that area, work with a therapist or counselor to improve emotional understanding and emotional awareness and help that child learn how to get those emotions out. That might be another way that that child can learn coping skills where maybe they're not turning to sugar, problematic kinds of behavior. Those are just some basic things to think about. I would also recommend self-control training because that could be a factor here. Learning about executive function because everyone with FASD is going to have executive function impairments, and that is going to be a major area to target with intervention. Self-esteem dynamics would be very, very important to target as well if there's an issue in that area. Consult with a dietitian, nutritionist. Help that individual reduce screen time exposure when possible. Get as much education as possible as a caregiver. If you can enhance your self-efficacy as a parent around these topics, you're going to feel more emboldened, more empowered to be able to speak up about these things in a very humble, kind way, of course. But self-efficacy equals basically we have greater beliefs in our own selves. So maybe there's a parent that doesn't know how to read labels. They don't have good cooking skills. They work with a professional, you enhance that. You're going to be more knowledgeable, more equipped to make those decisions and to be able to say no to your child if you go to the grocery store and that child's harassing you day in and day out. I want this, I want that, give me that and that. Maybe you go to a different grocery store, you go down a different aisle so you don't trigger that child too, or me. A lot of little things we can do that are very subtle that I think can build upon each other. Another thing I will say too, use strengths-based approaches.
Yes.
Capitalize on that child's hobby, skills, interest. If you can capitalize on those things and you can nudge them down a path of health and wellness, and you're just modeling that behavior, unhealthy eating habits may not even enter their brain that much anymore. If you can nudge them along a different path. Again, a lot has to do with what's going on in the family system, what's going on in their friendship network, and unfortunately, what's being modeled in school as well. I think teachers play a vital role here too, making sure teachers understand these topics and starting to provide education in the classroom about these things can maybe be helpful as well.
Definitely. One quick question, something you said, self-control training, executive function, help with that. Where would a parent go? Because so many of us, our kids, especially with the FASD, executive function is a challenge that's affected. So, where would we learn, or how, where could we learn, or how could our kids get self-control training, executive function, coaching, that kind of thing?
Unfortunately, with that, you can Google, you can find numerous different professionals online all around the country who are executive function coaches. Most of them are not going to be FASD trained.
Right.
And insurance typically won't pay for that. And a lot of those coaches, unfortunately, they charge a lot of money. So that could be an option. Finding therapists who understand these topics, excellent idea, I think.
Mm-hmm.
Skills workers play a huge role. Every state's different. They probably have different terms in different states, but in Minnesota, there's skills workers, there's CTSS workers, child therapeutic support services. There's something called ARMS in Minnesota for adults, adult rehabilitative mental health services. Look at your state. Are there coaches? Are there in-home skills workers? Are another term you want to be aware of, like psychiatric rehabilitation, or folks that specialize in enhancing functional skills or adaptive functioning? Those would be good search terms to search in your particular state, what your state offers. Contact your local county, social workers, case managers, ILS workers, independent living skills, PCAs, personal care attendants. They might have different terms in your state, Sandra. Those are all terms used in Minnesota where I live and stuff. That'd be a good starting point. Folks run into dead ends, send me an email. I can send you some handouts I've created on different things that are very practical. There's different workbooks you can find online and different programs for like self-control, self-regulation training. I am aware of a program called the Alert Program. I don't know them personally, but they have a really nice website and they have workbooks on their website. And there's been some articles published, I think in the FASD literature and the autism literature, where they have found that the Alert Program has helped reduce self-control deficits among some individuals in these studies. So that'd be another good online resource to take a look at.
Very good. Well, lots of great stuff there, Dr. Brown. So we're at the end of our time here, but as we wrap up, any last thoughts that you want to make sure you let us know?
Consult with a nutritionist dietitian. I think that can play a vital role. I also do believe occupational therapy and sensory processing are a vital component to this, and feeding specialists too. And two other things I will mention. Anything you can do to enhance metacognition, that can be helpful here. There's actually some articles that have been published on if you enhance metacognition, people make better choices around the drinks they consume. Metacognition is thinking about thinking and knowing about knowing. It's kind of the ultimate executive function. I think we've done a segment on that, if I remember,
Yes.
in the past. I encourage your audience to take a listen to that, because that is a very good intervention to use with any problematic behavior, because the more we think about our own thinking, we're more insightful. We can tap into our own internal resources. And don't do this alone, folks. Consult with other professionals in your community. Do some community ed classes. Someone should probably develop a community ed class in these topics. Get your schools to get trained on this. Get your mental health providers to become more aware. Start from the ground up, offer more trainings, more resources, more podcasts, more handouts on these things, because intervention starts with just being aware of this topic, because this might be the first time some of you have heard the connection between excessive energy drink consumption and these problematic behaviors. Now that you know this, what are you going to do about it? Call to action. Now that we know, I feel obligated to share. Hopefully all of you do now too, and pass this information along to other folks in your network.
Wow. Well, Dr. Brown, as always, you've educated and enlightened us on another important topic, and I can't wait to have you back on the show again in 2025. Thank you so much for sharing and teaching us and for being with us today.
Great to be here, my friend. Looking forward to being back, and I hope all of you have a wonderful holiday.
Thank you so much. Wow. Always so good to hear from Dr. Jerrod Brown. We will be having him on throughout 2025. So be on the lookout for those episodes. And thank you for listening to the Adoption and Foster Care Journey. I hope you enjoyed our conversation. I highly recommend that you go back and listen if you are a newer follower of this podcast. If you haven't listened to my other episodes with Dr. Jerrod Brown, gosh, we did dozens of episodes with him as far back as 2022. Just scroll through our catalog of episodes and they'll pop up, or you could Google or search this podcast, Adoption and Foster Care Journey podcast, and put his name in. and you'll be able to find them there as well. We did a whole series of close to 20 episodes, where the name of the series was What Every Adoptive and Foster Parent Needs to Know. And he was our guest in every one of those episodes. And we had a whole episode on alexithymia, he mentioned that in today's episode, a whole episode on metacognition and so many other things. He takes us deep into the weeds too. So I highly recommend going back and listening to those episodes. They are some of our most listened to episodes, very, very popular, and you won't want to miss those. You will want a notebook. I don't know if you noticed, if you're watching this on YouTube, you may have noticed my head down and I was just scribbling like crazy because whenever Dr. Jerrod Brown is on, I just have to take a whole lot of notes because he says so many wonderful things. And sometimes I have to go back and actually listen to the podcast after we release it, because it's kind of hard to be the interviewer and then catch everything that he's saying. So I like to go back and listen because such valuable stuff, very educational. So I hope that you will check those out. In addition to educating and encouraging you on this podcast, of course, we want to equip you for your parenting journey. You heard about our support group, Hope for the FASD Journey. So if you are a parent or caregiver who knows you're raising children who were prenatally exposed to alcohol, or if you just think it's possible that your kids don't have a diagnosis, to be part of that group, it's like the only Christian support group for parents and caregivers raising kids prenatally exposed to alcohol in the world, I would have to say. And I hope that you will check it out. If you're on this journey and you feel like you need that support, you don't have to go it alone. We're here for you. I'm on this journey with you. My kids that have FASD, our youngest two adopted, are 19 and 21 years old. They have fetal alcohol syndrome, of course, and trauma and all of the things. So I am on this journey and didn't have those resources in the early days. I've been doing this for 30 years, and want to provide for you, to you, the resources that I wish I had many, many years ago. So we have not only this podcast as a resource and the support group, but of course I do online and in-person FASD trainings. And I offer a free one every month, as well as some longer deep dives for a registration fee. In January, you'll be able to go to our website, justicefororphans.ny.org, and start seeing the upcoming trainings that are listed there. And I also do one-on-one parent coaching. So if you wanted to meet with me personally via Zoom once a month or once a week, I do offer coaching. And you can also check out my personal website, sandrafleck.com, where I blog on there. And of course, subscribe to this podcast, whatever platform you listen to it to. If you subscribe, follow, leave a review, rate the podcast, that is a huge, huge blessing to any podcast host, any podcast that you follow, because when you do that, it helps make the podcast available to even more people. It makes it easier for people to find it. So I highly recommend that you do that for not just this podcast, but any podcast that you listen to and enjoy. So make sure that you do that. Find and follow us on social media. Justice for Orphans and myself, Sandra Flack, are on Instagram and Facebook as well. Would love for you to check out those pages as well. And again, I'm so thankful that you spent your valuable time with me today and this year. And we look forward to having some fabulous guests in 2025. So I ask and hope that you will continue to listen and follow along, because I am grateful to have you along on this journey.
Thank you for listening to this episode of the Adoption and Foster Care Journey podcast, brought to you by Justice for Orphans. We hope you were encouraged today. Please be sure to subscribe to this podcast and leave a review, and share it with your fellow foster and adoptive parent friends so they can be encouraged too. Be sure to find and follow us on Facebook and Instagram at Justice for Orphans. And check out our website for vital resources at justicefororphansny.org.